Hey everyone, and welcome back for another deep dive. We love to take a close look at current events that are relevant to policy. And today we're talking about something that's definitely going to be on your radar if you're prepping for the UPSC exams.
Oh, absolutely. This is one of those issues that just brings up so many different angles.
Yeah, exactly. We're talking about Crosspathy in India. And to really get into it, we're going to be looking closely at a recent article from The Hindu.
A great source, by the way.
It is. It always has such thought-provoking pieces. So in this article, they discuss a new directive from the Maharashtra government that's causing quite a stir.
And it's controversial for sure.
It is. Basically, they're allowing homeopathic practitioners to prescribe allopathic medicines.
Which, as you can imagine, has stirred up a lot of debate.
Definitely. And that's exactly why we're diving into this today. Because it's not just about healthcare. It's about the intersection of healthcare with policy ethics, even the legal system. And for those aiming for top roles in the civil services, these are the kinds of complex issues you need to be ready to tackle.
Couldn't agree more.
So let's start with the basics. For anyone who needs a refresher, what exactly are we talking about when we say crosspathy?
Right. So in the simplest terms, crosspathy is when a healthcare provider trained in one medical system prescribes treatments from a different system. Like imagine an Ayurvedic doctor prescribing antibiotics or a homeopath recommending surgery. That's crosspathy.
Okay, so that makes sense, and I think it's clear why that would raise some eyebrows. Why is this such a hot-button issue?
Well, one of the biggest concerns, and it's a valid one, is patient safety, right? You have practitioners who are trained in a specific system of medicine, and critics worry that they might not have the deep knowledge of allopathic medicine to make the right calls.
Meaning they could misdiagnose or give the wrong treatment.
Exactly, and that's a huge risk, especially when we're talking about people's health.
So it's not as simple as just expanding access to healthcare. You need to make sure that the quality of that care is up to par.
Precisely, and that's where the ethical and legal aspects come into play. The Indian Medical Association, the IMA, they've been very vocal against crosspathy.
I can see why. They're the ones on the front lines, advocating for patients and upholding medical standards.
Exactly. And their argument is that crosspathy dilutes those standards. It puts patients at risk because you're essentially allowing practitioners with less rigorous training to handle complex medical situations.
That's a strong argument. And they're not just talking about ethics here. They're also bringing up the legal side of things, right?
Oh, absolutely. There have been court cases challenging this practice. The Supreme Court has actually ruled that in most cases, crosspathy can be considered medical negligence unless there's a specific law permitting it.
Wow. So that makes the Maharashtra directive even more interesting. Because it seems like they're going against these legal precedents.
It does seem that way, but you have to understand the context here. Maharashtra, like many other states in India, is facing a massive shortage of doctors.
Especially in rural areas.
Exactly. We're talking about a situation where people have to travel for miles, sometimes hours, just to see a doctor. And a lot of times those doctors are already overburdened with too many patients.
Yeah, I remember reading a report that said there's something like an 80% shortfall of specialists in community health centers.
That's right. And those centers are meant to be the primary source of care for a lot of rural communities. So the Maharashtra government is looking at the situation and saying, we need to do something.
So they see this move to allow homeopathic practitioners to prescribe allopathic medicines as a way to fill that gap.
Exactly. They're essentially saying, we have this existing workforce of AUS practitioners. Let's leverage them to expand access to healthcare. And in terms of numbers, it makes sense. There are significantly more AUS practitioners than allopathic doctors in India.
But like we said before, it's not just about numbers. You have to balance that increased access with the potential risks.
You're absolutely right. And this is where the Maharashtra directive gets interesting. Because they're not just giving a free pass to all AUS practitioners, they're requiring them to complete a certificate course in modern pharmacology before they can prescribe allopathic meds.
So they're trying to strike a balance, trying to ensure some level of competency.
Exactly. It's an attempt to address the concerns about quality while still addressing the urgent need for more healthcare providers.
It's like they're walking a tightrope.
That's a great way to put it. And that's what makes this whole issue so fascinating. It's not black and white. It's this complex interplay of competing priorities and ethical dilemmas.
A real policy puzzle.
Yeah.
And one that's going to have a significant impact on the lives of millions of Indians.
No doubt about it. And it's not the first time Maharashtra has tried something like this. They've been pushing to expand the scope of practice for AYUH practitioners for a while now.
Oh, really? I didn't know that.
Yeah, back in 2014, they redefined what it meant to be a registered medical practitioner to include certain AOH practitioners. And then just last year, they issued another directive clarifying that chemists have to honor prescriptions from these practitioners.
So it's a continuous effort on their part.
It seems that way. And this latest directive is just the most recent development in that ongoing effort.
Well, it's definitely brought the issue back into the spotlight, and it's a debate that's not going away anytime soon.
Not at all. It goes to the heart of how India is going to tackle its healthcare challenges. And for those of you listening who are aspiring to be future policymakers, this is the kind of complex issue you'll need to grapple with.
Exactly. So let's take a closer look at those challenges and the potential implications of this policy, because this deep dive is all about going beyond the headlines and understanding the real-world impact.
Absolutely. So in the next part of our discussion, we're going to delve into what this policy could mean for patients, particularly those in rural communities who rely on both allopathic and AYUSH practitioners for their healthcare.
Sounds like a crucial conversation.
Yeah.
Because at the end of the day, it's the people who are most affected by these decisions.
Exactly. And their voices need to be heard.
Okay, so we've been talking about this from, kind of a policy perspective.
Yeah.
But I think it's important to really zoom in and think about what this means for people on the ground.
Absolutely. Let's put ourselves in the shoes of someone living in rural Maharashtra. You're in a village. Maybe the nearest allopathic doctor is miles away. You've got this homeopathic practitioner who's been serving the community for years. Everyone trusts them. Now they can prescribe allopathic medicines too. What does that actually look like for you as a patient?
Right. That's the reality for a lot of people. And it's not a simple situation.
Not at all. On the one hand, you've got increased access to some kind of health care. You don't have to travel those long distances or maybe wait as long to see someone for basic medical needs. And you might even have a good relationship with this practitioner, someone who understands your community and your concerns.
That makes sense. Having someone you can turn to for medical advice right there in your village, that could be a huge relief. But of course, there's the other side of the coin.
Exactly. You can't ignore the potential downsides. What if what you think is a simple cold is actually something more serious, something that needs a specialist's eye?
And what if this practitioner who's been given this new authority misses those signs?
That's the worry, right? A misdiagnosis or a wrong prescription could lead to delays in getting the right treatment, and that can have serious consequences.
Especially if you're in a remote area and don't have easy access to other medical opinions.
Exactly. And that's where the whole debate about the quality of care really hits home.
Because a short course in pharmacology can't magically replace years of medical school.
It's a complex issue, and I think for our listeners who are thinking about careers in policy, this is a perfect example of the kind of tough choices you might have to make.
How do you weigh the benefits of increasing access to care against the potential risks to patient safety? It's a balancing act.
It is, and it's a dilemma that policymakers all over the world are grappling with. How do you ensure health care for everyone without sacrificing quality?
Right, because at the end of the day, we want solutions that actually work for people, not just on paper, but in their lives.
Absolutely. So let's talk about solutions. If just allowing crosspathy isn't the answer, what are some other ways to address this healthcare gap?
Because clearly there is a gap,
Yeah.
and people need access to care.
Right. So one idea that's been gaining traction is something called task shifting.
Task shifting. What does that mean?
Basically, it's about thinking about healthcare as a team effort. Instead of relying solely on doctors who are already in short supply, you train other healthcare providers to take on specific tasks.
So like nurses or community health workers.
Exactly. They could be trained to do things like administer vaccines, provide basic health education, even manage chronic conditions like diabetes or hypertension.
That makes a lot of sense, especially in rural areas where you might not have a specialist for every single issue.
Right. It's about extending the reach of the healthcare system without necessarily needing more doctors in every village.
And are there examples of this actually working?
There are. A lot of countries have seen success with task-shifting programs. Bangladesh and Ethiopia have great community health worker programs that have made a huge difference in maternal and child health. And even here in India, Kerala's ASHA program has been really effective.
So there are models out there that could work for India.
Definitely. It's about adapting those models to our specific context. And of course, training is key. You need to make sure these healthcare providers are well equipped to handle the tasks they're given.
That makes sense.
Yeah.
You don't want to compromise on quality just because you're expanding the workforce.
Exactly. It's about investing in training and creating clear guidelines for what each type of provider can and can't do.
So task shifting is one idea.
Yeah.
What else is on the table?
Well, we've talked a bit about telemedicine before, and that's another area with huge potential, especially for connecting people in remote areas with specialists in cities.
Yeah, that sounds like a game changer. Imagine being able to consult with a doctor hundreds of kilometers away without having to leave your village.
It could really revolutionize healthcare access, and there are already some exciting examples happening in India. The Apollo telehealth platform is doing great work, and there's the Swasthya Slate program, which uses tablets to deliver healthcare services to remote communities.
So technology can really play a role here, but I'm guessing it's not without its challenges.
Oh, there are definitely challenges. Internet access, digital literacy, those are all hurdles that need to be overcome.
Right. Not everyone in rural India has a smartphone or a reliable internet connection.
Exactly. So part of the solution is also investing in infrastructure and making sure these technologies are actually accessible to everyone.
It's about bridging the digital divide along with the healthcare divide.
Exactly. And even with task shifting and telemedicine, we can't forget about the root of the problem.
Which is the shortage of doctors.
Right. We need to be thinking about how to attract more qualified MBBS doctors to work in rural areas.
Because ultimately, having enough doctors is crucial.
It is. And that means making rural postings more appealing, offering better salaries, housing allowances, and other benefits to make it financially viable.
But I imagine it's not just about the money.
No, it's also about the working conditions, the infrastructure opportunities for professional development. Doctors need to feel like they can build a fulfilling career in rural areas.
So it's about creating a whole ecosystem that supports rural healthcare.
Exactly. And it's about changing the perception of rural postings. Instead of seeing them as a compulsory service obligation, we need to make them desirable career choices.
So it's a long-term strategy.
It is. And it involves multiple stakeholders working together.
Well, I think this highlights something really important about this whole issue.
What's that?
There's no easy fix. It's complex, it requires a nuanced understanding of the challenges, and it demands solutions that are sustainable and equitable.
You're absolutely right. And for those of you listening who are preparing for the UPSC exams, this is the kind of complexity you'll need to be comfortable with.
Because being a civil servant isn't about having all the answers. It's about being able to analyze a situation, weigh the different options, and make informed decisions.
And that often means navigating those gray areas where there isn't a clear right or wrong answer.
Well, I think we've done a good job of exploring those gray areas in this deep dive. But before we move on, I want to circle back to the Maharashtra directive, because it's such a concrete example of this complex issue. What are the key arguments for and against this approach? And how should our listeners think critically about this situation as they form their own opinions?
That's a great question, and it's one that requires careful consideration. On the one hand, you have the proponents of the directive who say it's a practical solution to a pressing problem.
They're looking at the immediate need for more healthcare providers.
Exactly. They argue that using the existing AYUS workforce is a way to expand access quickly and efficiently.
And they also point out that in many rural communities, people are already relying on AYUS practitioners.
That's right. It's about meeting people where they are and utilizing the resources that are already available.
But on the other hand, you have the critics who are worried about patient safety.
Right. They argue that the short pharmacology course isn't enough to ensure that AYUS practitioners can safely prescribe allopathic medicines.
So there's a clash between pragmatism and professionalism.
Exactly. And navigating that clash is part of what makes policymaking so challenging.
Because you have to consider all sides of the issue and make decisions that are the best interests of the public.
And sometimes those decisions involve tough choices and trade-offs.
Well, this has been a really insightful discussion so far. But I know there's even more to unpack.
There is. In the final part of our deep dive, we're going to step back from the Maharashtra example and look at the bigger picture. We'll talk about the broader implications of Crosspathy for India's healthcare system, and we'll explore some potential long-term solutions that go beyond this immediate controversy.
So we've really gotten into the nitty-gritty of this Crosspathy debate in India. And I think it's highlighted how complex our healthcare system really is.
It is. In the Maharashtra case, it's really just a small piece of a much larger puzzle.
Exactly. India's healthcare system. It's facing so many challenges, resource constraints, infrastructure gaps, and of course, this huge disparity in access to quality care, especially in rural areas.
It's true. And we've talked about how Crosspathy might seem like a quick fix in some situations, but in the long run, it's not a sustainable solution.
Right? We need to be thinking about those deeper systemic changes, the ones that actually get at the root causes of these healthcare disparities.
Absolutely. And for those of you out there who are thinking about a career in the civil services, this is the kind of thinking you need to be prepared for. It's not just about reacting to problems. It's about understanding those underlying systemic issues and coming up with policies that address them effectively.
So beyond this specific case in Maharashtra, what are some of the big takeaways for our listeners? especially for those prepping for the UPSC exams.
Well, one of the biggest lessons here is that India's healthcare system, it's not one size fits all.
Right, we have all these different systems of medicine coexisting.
Exactly, and each one has its own strengths and its own limitations.
It's not about saying one is better than the other. It's about finding ways to integrate them in a way that makes sense.
And in a way that puts patient safety first.
That's key.
Yeah.
And for that to happen, you need a strong regulatory framework.
Absolutely. Clear guidelines that ensure practitioners are properly trained and that they're providing care within their scope of practice.
And this regulation, it can't just be a state-by-state thing.
You're right. You need a consistent national framework.
That would help avoid a lot of the confusion and potential legal issues we're seeing now.
Exactly. It would provide much-needed clarity.
Okay, so regulation is a big piece of the puzzle. What about some of those other long-term solutions? How do we tackle this doctor shortage and make sure everyone in India has access to good health care?
Well, we've talked about task shifting and telemedicine, and those are still promising approaches, but we also need to make rural postings more attractive to MBBS graduates.
Yeah, we touched on that before, but it's worth digging a little deeper. What are some concrete things we could do to incentivize doctors to work in rural areas?
Well, financial incentives are definitely a part of it, offering higher salaries, housing allowances, things like that.
Makes sense. Make it financially worthwhile for doctors to choose those rural postings.
Exactly. But it's not just about the money. You also have to think about the working conditions.
Right, the infrastructure,
Yeah.
the support staff.
Doctors need to feel like they can build a fulfilling career in rural areas. They need to have access to the resources and support they need to do their jobs well.
So it's about creating an environment where they can thrive.
Exactly. And it's about changing the whole perception of rural postings instead of seeing it as something you have to do, maybe even a punishment.
Turn it into something that doctors actually want to do.
Right. Make it a desirable career path.
So it's not a quick fix.
It's not. It's a long-term strategy that requires a real commitment from everyone involved.
And a willingness to invest in rural healthcare.
Exactly.
Okay.
Because in the end, investing in rural healthcare, it's investing in the health of the entire nation.
Well said. And I think this conversation has highlighted something really important about policymaking in general.
What's that?
It's rarely black and white.
Right. It's about understanding those nuances, being able to look at an issue from multiple perspectives.
And make decisions that take all those factors into account.
Exactly. And for those of you listening who are thinking about a career in the civil services, that's a skill you'll need to develop.
Absolutely. Because the best policies, they're the ones that are grounded in a deep understanding of the issues and a willingness to consider all sides of the story.
Couldn't agree more.
Well, I think we've done a pretty good job of exploring those different sides in this deep dive. We've talked about the complexities of crosspathy, the challenges facing India's healthcare system, and some potential ways forward.
It's been a great conversation, and I hope our listeners have come away with a better understanding of this really important issue.
I hope so. And as always, we encourage everyone to keep learning, keep digging deeper. And for anyone who wants to read more about this specific case in Maharashtra,
Definitely check out the full article in the Hindu.
it's a great starting point and a great example of the kind of in-depth reporting that can really help you understand these complex policy debates.
Exactly.
So thank you all for joining us for this deep dive.
And as always, don't forget to subscribe and like our show for more discussions on the issues that matter.
Until next time, keep those brains engaged and keep asking those tough questions.